As we gear up for the 4th of July weekend, health experts want you to think twice before going to family cookouts and hanging out with family and friends. As COVID-19 cases continue to rise, experts say it's best to play it safe. Amy Wadas explains, new at 5.
If you're thinking about putting out a spread of food for your 4th of July party, health experts suggest putting a bottle of hand sanitizer on the table to encourage good hand hygiene before your guests start grabbing the snacks. Since a lot of the popular fireworks shows in and around Pittsburgh are canceled this year due to COVID-19, people will likely be gathering in other ways to celebrate our country's independence. So if that's your plan this weekend, health experts say be smart about it.
Try and keep the gatherings to a reasonable number of people, hopefully people that you know very well.
While most gatherings will be taking place outside, there are still things Juliet Forelli with AHN says you need to do to stay COVID-free. Forelli says have a larger space for your cookout so partygoers can stay socially distant. Also, she suggests wearing a mask if you are over a certain age or are high risk.
I would, recommend still wearing a mask unless it's a small gathering. It's your family you already interact with and they've been social distancing.
While the food is typically the draw of the party, Forelli recommends being mindful of what and how you serve it.
Maybe having small bags of chips instead of just a big bowl of chips to open up.
If you plan to get together at one of the county parks, Allegheny County says it's taking extra measures to make sure shelters aren't filled with people this weekend. The county says this year they have 98 shelter and building rentals, but the capacity has been reduced by 50% per guidelines from the state. Park rangers and staff will be out and about reminding users about social distancing, wearing a mask, and other safety measures. Forelli says she expects to see a small spike in COVID cases after the holiday weekend, but she doesn't feel it will be enough to overrun hospitals. Reporting from home, I'm Amy Wadas.